Having a filling is one of the most common dental procedures, and most of us at some time or another in our lives will have to have one. Fillings are mainly used to treat decay, but they can also be used to repair a chip or a crack, or even for aesthetics. And they can range from a very small and superficial reconstruction to a full tooth rebuild in some cases. But generally, no matter the size, the steps are usually the same. One common question we get asked about fillings is, will I need to have a local anesthetic? And the answer is, like many other things in medicine, it depends. So there are lots of circumstances where a tooth just won't feel sensitive. Maybe it's an existing filling that's broken and it's a very small chip. Maybe the tooth has had root canal treatment, so it just doesn't have any live nerve. Sometimes a tooth just isn't sensitive, and in those circumstances, using a local anesthetic is not usually required. However, if we are removing decay, or if it's a large filling, or if the tooth is feeling particularly sensitive, it's not a bad idea to administer local anesthetic. It's a really easy procedure these days, and certainly can make the whole procedure feel very comfortable. So when it comes to actually doing the filling, the steps are pretty much the same no matter the size. So firstly, what we're doing is we're removing any decay, we're removing any old filling material, and we're preparing the tooth structure to receive the filling. We're cleaning everything up so we've got a nice fresh environment in which to bond the filling to. If we have to build the tooth structure up, or if the filling is going to be right next door to another tooth, we use a little thing called a matrix, which you can think of like a frame or a formwork that we put on or around the tooth to help us get that right contour and a good shape when we're placing the filling. These days, most tooth-coloured fillings are placed in layers, and they are set and hardened as each layer is placed. And finally, once we've filled the cavity or we've built up enough structure, we'll smooth and polish the filling so that it feels comfortable in your bite and feels smooth on your tongue. Most tooth-coloured fillings are strong enough to eat on the day that they're placed, but it's still a good idea to be careful for the first 24 hours, especially if you've had to have a local anesthetic.